Hey everyone, welcome to the video version of the Reviving Vet Med podcast. Today we're exploring the intersection of veterinary medicine, holistic wellness, and personal renewal, both for our patients and ourselves. Joining me today is Dr. Galina Bershteyn, a veterinarian, certified acupuncturist, food therapist, and AVMA Veterinary Wellbeing Educator who brings more than 3 decades of experience in vet medicine. Galina's career has taken her from vet tech to DVM through emergency, equine, exotic, and integrative practice, and now to Costa Rica, where she runs Pura Vida Vet Wellness. Her work blends traditional Chinese veterinary medicine with preventive care and a deep commitment to well-being, both for animals and the people who care for them. In this conversation, we dive into how acupuncture, food therapy, and other holistic approaches can support not just patient health, but also the mental, emotional, and physical well-being of veterinary professionals. Galina shares how living in harmony with nature, immersing herself in the ocean, and engaging in creative pursuits like music and art have helped her to stay grounded, resilient, and inspired. If you've ever wondered how to integrate more balance, creativity, and connection into your veterinary career or your life, this episode will give you plenty to think about. So let's go ahead and get into the conversation. All right. Hi, Galina. I'm so happy to have this conversation with you today. Thanks for being here.
Thanks for having me, Maria. I'm really excited to be here.
Yay. We're going to get right into it. I want to start with your journey. It has been so unique from RVT to DVM to certified acupuncturist and food therapist. What has inspired you to pursue all of these modalities, and how have they reshaped your approach to medicine and wellness?
Yes, Marie, that's a really kind of a big encompassing question, I think, but I'll try and answer it concisely. So yes, I started as an RVT, and I think it's funny because partly the reason I went to RVT versus veterinarian right off the bat had to actually, I think, do with like self-esteem issues, like kind of looking back on it, that whole the whole topic about well-being and self-care. Well, I wasn't very good at that for sure at that point. So I was thinking, okay, well, maybe if I, kind of start small, work my confidence up, see if I can do it, because, that long of a schooling was very intimidating for sure. And I wanted to do other things. Like I wanted to travel Europe. I wanted to do this. I wanted to do that. So that actually led to my journey of going to Europe and getting a working holiday in England as an RVT. And that kind of, solidified my journey as a veterinarian, because that sort of solidified the decision that I wanted to go back and do
Mhm.
more schooling. And then, how as an adult student going back to school, you're really enthusiastic and excited. So, I learned as much as I could, obviously, with, at OVC at the Ontario Veterinary College, which of course you're familiar with because I think you were there during the last couple years that I was there. So,
Mhm.
yay. uh, but interestingly enough, when I worked, so because I was a technician, I was able to work like in the anesthesia department. And my first, I guess, introduction to holistic medicine was actually through one of the anesthesia. Actually, no, she was an intern. She was an intern in internal medicine or resident. Sorry, Ainsley, I think. Ainsley. I wish I could remember her name. Anyways, she showed me like a resuscitation point, like right here between GV26. So she showed me this point and said, "Oh, I learned this the other day." And sure enough, she would use this consistently. And she also showed me a herbal that she would use for blood clotting,
Mhm.
which she would use either internally or, on the outside of a wound. And I thought, oh my gosh, like, this board certified and, they're doing this. This is cool. So that was kind of my first intro into it. And then during my last year when I did an externship, I was in, well, I was really interested in equine at that point. And the externship that I did was with a solo practitioner in, Niagara Falls area. And she was doing acupuncture on these horses and doing therapeutic ultrasound. I think she was one of the first people actually doing acupuncture in Canada,
Mhm.
uh, in general. So again, that sort of piqued my interest, and I was as I was doing, the externship with her, I would see how she was doing that. Anyways, I saw how, um, somehow I couldn't explain why, but it worked. So that piqued my interest. And then after graduating as a veterinarian, working in Toronto in small animal, I don't know. It's funny because I look back on it and I think I started to really the burnout really kind of started at that point
Mhm.
on my journey. And I was looking for something else
Mhm.
in veterinary medicine, so that I landed back onto holistic medicine, acupuncture specifically,
Mhm.
and I started looking into what programs I could do, what information I could find, and I ended up at the Chi University now. It's in Reddick, Florida, and I started with just the basic acupuncture course, and I wanted to do the traditional philosophy of it. So there's different ways of doing traditional Chinese medicine, but I wanted the full experience.
Mhm.
And because I think I decided to do it that way, I realized how those modalities actually made me look at not only my patients as a whole, like, because it would look at every aspect of their environment, of their health, like it would be a total health philosophy that it would look at. So everything was connected, including, your small pinky toe is, oh, you have a brain tumor. Oh, well, that makes sense. Like you could connect things that way in certain ways that Western medicine never explained for me. And then I could see that in myself. So I started realizing like how much of what I was doing was really not healthy. So
Mhm.
I started actually inadvertently changing my own lifestyle. The more information and the more deeply I got into the holistic medicine side.
I love that. Well, I won't out the individual you're talking about on the podcast because I know her well and I don't think she would like it. But Ainsley was a resident of mine in emergency and critical care. So I know exactly who you're talking about. Ainsley, hi, if you're listening. And so, yeah, so we have a specific acupuncture site that we use for resuscitating newborns or other animals during CPR, specifically stimulating their respiratory drive. And then I'm guessing it was Unan Bio that was the herb for stimulating blood clotting.
Exactly.
Such a small world, Galina.
I know.
So, I think most people know what acupuncture is. I certainly have used acupuncture routinely in my life, sometimes for physical ailments like foot pain or, recovering from injuries or whatever it might be. Sometimes for psychological ailments like my anxiety or, if I'm having difficulties relaxing or whatever it might be. I think people might be a little bit less familiar with food therapy. But I'm wondering if you can kind of explain a little bit. You shared a little bit about acupuncture, but with food therapy, how does that work? And how do you see these modalities intersecting with well-being among veterinary professionals, which is, of course, something that you and I are both very passionate about?
Yes, absolutely. Well, I mean, food therapy, it's one of the branches of, so traditional Chinese medicine is kind of an all-encompassing term. It has different branches. It has 5 branches actually. So acupuncture is one. Um, well, obviously food therapy is one. There's a tunai, which is like a massage. That's another branch. There's also like meditation and movement as well. So, but it's all based on sort of 5 elements theory, which is interesting. So with food therapy, again, it sort of looks at, your body as a whole, your body in relation to your environment, which includes, the time of year. Do you live in a city? Do you live in the country? What kind of lifestyle do you actually have? And it also looks at what's called your constitution. So, I mean, we look at that to a certain extent in acupuncture as well.
Mhm.
However, it's even more so in food therapy because, I mean, in a nutshell, traditional Chinese medicine, the 5 element theory is based on, everybody is made, there's 5 elements in the universe and everything is made up of those 5 elements. So um, everyone has some of those elements, like all of those elements in them. However, one may be predominant, one or two may be predominant. So one of the things about food therapy is it looks at, okay, here's your constitution, here's your environment, here's what your goal is. So whether it's prevention or treating a disease,
Mhm.
um, and then you eat appropriate foods to help you either to maintain health or prevent diseases or to actually treat an issue.
Mm-hmm.
So for example, say you have a hot condition of inflammation, right? So that's inflammation is considered hot.
Mm-hmm.
You would choose a food that would be a cooling food to help you decrease the temperature. You see, so it kind of makes sense, and you're eating for balance. That's the goal
Okay.
of food therapy in general.
Is
So
that the same as Ayurvedic medicine? Is that
it's
or
very similar.
similar? Okay, okay. Because I'm
Very
like
similar. Yes.
you're speaking my language here as a yoga teacher and dipping a little bit into that. But okay, that's cool.
Yes. I think
Okay,
there's a lot of overlap. Obviously, it's, the Eastern medicine philosophy, like traditional Chinese medicine is based on Zen Buddhism. It's a philosophy of medicine.
right.
So it looks at patterns, it looks at seasons, it looks
Mhm.
at, you know, your emotions. Like how we say, oh, you can die of a broken heart. Well, in Chinese medicine theory, yes, you can actually. So, but you can also eat foods to help, counterbalance that,
Yeah,
help you
yeah,
get over it. So it's really interesting. But the whole principle, whether it's acupuncture, food therapy, meditation,
yeah,
movement, massage, it's all to put the body back in balance,
yeah.
whatever balance is. So if your primary constitution, like mine is, for example, water.
Mm-hmm.
So for me, that's actually one of the reasons I live in Costa Rica, close to the water, because for me, I need an environment that is conducive to water
Okay.
and salt specifically, because in Chinese medicine, salt is the taste of water. Anyways, and I won't get too much in too many details on
Yeah.
that. But there's specific tastes, there's specific smells, emotions that are related to those five elements.
Yeah, I love that. It's fascinating.
Very
Well, I mean, you've worked in so many different areas in vet med. You shared equine, exotics, holistic, emergency, which of course is a common passion of ours. What are some practical ways that you've seen holistic approaches help in terms of reducing stress, preventing burnout, and promoting resilience among caregivers? Because you've been exposed to a whole lot of modalities and individuals. What are just a few ways that you've seen these be a benefit?
Yeah, absolutely. I think we can actually use so many different. I mean, I don't think it's just one thing. Obviously, you have to have an arsenal of of tools and skills and methodologies that you can tap into at any given time. So, for example, when I used to work at the emergency clinic, and I would do a lot of overnights. So, and I couldn't eat. So food therapy was kind of out. That kind of went out the window. I was just starting to get interested in that actually when I was at the emergency clinic because of the experiences that I had. But one of the things that really worked for me was, you don't have much time when you're going from on an overnight shift from one patient to the next, but you might have time to, run into the bathroom for a second if you're lucky. And then you can potentially do like, a breathing technique,
Mhm.
which again is one of the branches of traditional Chinese medicine is meditative, which is obviously breathing, a lot to do with breathing. So, I would literally, I would only have a minute. So while I'm peeing, I'm doing this breathing exercise.
Mhm.
So that would help. Also, just when I was able to eat, because actually that was one of my challenges working in emergency. I lost so much weight I
Mm.
couldn't sleep and I couldn't eat properly. Yeah, I know. So when I did, the Chinese medicine actually helped me as far as using things like green tea,
Mm.
right? Even just having that as an antioxidant and anti-anxiety, right? Because that's a natural anti-anxiety. So even just using small things like that, um, or if I was able to eat, I would have something that was, um, you know, in line with what I was missing. Like whether, if it was in the middle of the winter, I would try and get something that was very watery because it's for my constitution and very warm. So something like chicken soup, right?
Mhm.
For example. So it doesn't need to be complicated. You just, I guess, are more aware of your body in general.
Mhm.
and how it's affecting everything else in your life. So I think it's really about creating that connection to your own body, which I think is
Mhm.
the key for well-being in general. I think,
Mhm.
as a profession, we tend to, focus all our energy outwards, that we have so much trouble focusing inside that we don't even know, what we're feeling half the time. And
Mhm.
that was one of the struggles that I think Chinese medicine really helped me with, is to really kind of focus on, what is my body actually feeling like? Okay, does it feel imbalanced? Okay, maybe I need to eat this, or
Mhm.
maybe I need to go and do a yoga, a yoga session, like prioritize it because, I'm
Mhm.
feeling, you know, drained otherwise. So it really helps to get sort of like a well-being schedule, like
Mhm.
designed for yourself, that's individual.
I love that. I love that. Yeah, I love the holistic approach, looking at everything. Like we know based on research that there is this mind body connection, especially this mind gut connection that we're really learning more about. There's, randomized studies that have shown that probiotics can actually help with mental health challenges like depression and anxiety. And there's a reason for that. Like that microbiome has ripple effects through the body. And I know here I am, going into Western medicine, but all that to say, like it makes good sense, and it even highlights some of the areas that we don't necessarily think about. And I'm constantly in awe. My acupuncturist is a traditional Chinese medicine doctor, and so she'll kind of, I don't know, be like feeling on my stomach or and just like that. Oh, you got a hot spot right here, or whatever. And I'm like, what are you like? What does that even mean? And oh, that's tied to this that you're feeling over here. And anyways, it's fascinating. And yeah, highly recommend that people consider looking more into that if that's something that interests you, whether as an adjunct to your veterinary practice or certainly for your own health and well-being, especially if you found that the traditional path of counseling and exercise hasn't worked for you. Maybe there's a reason for that, right?
Exactly. And it's just having more tools and being more introspective and understanding, like, oh, well, maybe I'm a little different than, my friend next door, or, because we're all very individual. So finding what works for you. And it's funny that you said that, the gut biome in Chinese medicine, that would, of course, that fits together. That's your heart, like your anxiety over controlling your gut, which is your earth, right? So that's your fire, scorching your earth. That
Yeah.
totally makes sense to me, right? So again, and you can almost sort of predict what the result, like I could always predict when I'd be in a bad mood because, oh, well, yeah, of course I forgot to, eat this, or I forgot to do my stretches, or, so you start to be more aware of
Mhm.
what you're doing, what you're not doing, maybe what makes you feel better. So I think it's invaluable to have it as at least something that you can look at as an experiment. Like, okay, maybe I'll try this and see if
Yeah.
I feel better.
Love that. It's fascinating. I want to talk about the fact that you live full time in Costa Rica, which you brought up. Constantly surrounded by nature and the ocean, for which I am forever envious. I would love to know your thoughts on how immersion in nature, especially the ocean, specifically for you, of course, as somebody who is, like you said, very like water, is one of the big components of you. How has that supported your well-being? How has that change in environment shifted your well-being?
Oh, it's actually been huge. It was like, I mean, in my situation, it was almost like an emergency. I came down here. I wasn't really planning to get here when I did. It was more of a long-term plan, but I felt like for my own mental health that I didn't really have another choice.
Mm,
So it was interesting how, like, I mean, I knew this was the place I needed to be, but how, it still, it still took something like a really big shift to
mhm,
make me actually do it. And it turned out to be obviously the best decision I've ever made in my life. Because I mean, honestly, looking back, like before I left, I was doing all the right things and I was starting to, kind of get those skills. But, it's like looking back, like if I only knew than what I know now, things would have been much different, of course. But I mean, the fact that I'm here is just a miracle in and of itself, how I got here. But what I noticed was like I had, I was on antidepressant medication, I was on anti-anxiety medication, and I was still struggling. I was not like I was thinking real fast, and my physical health was struggling. Like I was struggling with my physical health as well. It was so interesting because it almost felt like I was breaking down mentally, emotionally, and then it was like my body's like, "Yep, see ya,"
Mhm.
I'm going too, right? Because that is that mind body connection, of course. Uh, so that just that change in environment, and I'm not going to say it was instant at all, because even now I still feel like I'm still recovering from, because it was just such a severe burnout that I experienced, unfortunately, because I didn't know I'd gone past that point
Yeah.
of almost like no return, right? um but that's okay, because I feel like there is still that point of no return, or there is a point of return. It's just some of us take a little longer than others, and that's fine. We all have our own journeys. But that change in environment was able to really let me focus on myself.
Mm.
So, and because it was during the pandemic, of course, borders were closed, like there was nobody here. So I think it was almost like a forced silent retreat in a way,
Mhm.
that I had to kind of go back to the basics of myself. Like, what what could I do to make myself feel good? Because I was literally at the point where nothing felt good. I was beyond numb. Like it
Mhm.
was, yeah. So I mean, I know with your experience, you understand what
Mhm.
I'm saying when I say that. Um, so it really just, it was like I just remember spending hours just staring at the ocean, just
Mm.
so my mind would be quiet, and that was the only way I could quiet my mind. Otherwise, it was like this. It was like this. So, and when I was in vet school, I remember the first year everyone took, did yoga class, and me, crazy lady that I am, I decided to do a NAUI 10-week scuba diving course at OVC with all the marine biologists. And I hated every minute of it. It was such a pain in the butt because I had to, I missed the bus every Tuesday because the pool went too long. And I never knew why I was doing it, but I just felt this, draw, like I had to do it. And then when I finally got to Costa Rica, and there was really nothing I could do. Like I couldn't work here. I was kind of in limbo for the first couple years. And I started diving, because I had been, diving for the last 20 years, just on vacations. And, when I was able to go, when I needed a break from the veterinary world, I would go and I would do, a course somewhere. That's how I would do it. So, and then all of a sudden I was faced with, okay, I'm not really a vet anymore because I just left. Everything's closed. I'm in a new country. Like I could literally be anything I want right now, anything at all, anything I ever dreamed of. And what I always wanted to do, I'm like, I want to dive. I just want to have the ocean. I want that to be my environment, because I couldn't handle the outside world at that point. So
Mm.
I literally just dove in. I dove in. I did my instructor training. I started teaching. I started working with these girls that literally I would entrust with my life every single day.
Mhm.
And that actually taught me how to work as a team. I'm like, oh my God, why can't we do this in veterinary clinics? Why? We would love our jobs. I mean, seriously.
Mhm.
And, it'd be so much easier. So the water, and, as soon as my head goes underwater, everything turns off. You can't call
Mhm.
me. I can't check my cell phone. I can't get messages. You can't even talk to me. It's just sign language, right?
Mhm.
So it really does go back to the basics,
Mm.
and makes you feel like you're part of something bigger than yourself, which I
Mm.
think is one of the things we also forget, getting wrapped up in our everyday
Mhm.
lives, and our, giving our energy away every day for all our patients, all our family, like everything, right?
Mhm.
But I think that's what is kind of the root of all the depression, all the anxiety, is when you feel
Mhm.
so alone.
Mhm.
You feel like you're the only one, or you feel disconnected from
Mhm.
like who you truly are, what you truly feel, and
Mhm.
that to me is the natural world.
Mm.
So since then, I'm off all medications. Like
Mhm.
literally, I've never been. I mean, I don't know. I mean, I remember my doctor saying, don't count on the fact that you're going to go to Costa Rica and then everything's going to be hunky dory. Like you still have an imbalance in your brain. because this is what depression is, and I've had it since I was a child. And I said, you know what? I don't accept that. I don't accept that. I think we have more control and more power than we know.
Mhm.
And it's just creating and building what's right for you. And
Mhm.
then
Mhm.
you can change the chemical structure of your brain. Of course you can. How
Mhm.
else how else do we grow as humans, as
Mhm.
people, Like, I feel like that's being too much of a victim when you think that that's not possible. I think the
Mhm.
medication should be something that we use to get to that point, to help us
Mhm.
with everything else, with counseling, with whatever you need, to get there. And I think there's a lot of different ways that that can look like, and probably a lot of different areas that you need to, you know, to bring in to help yourself. But I think
Mhm.
environment is huge, and I think we forget about that.
Yeah. Oh, so many important things to unpack. And, when it comes to depression and medication specifically, I think everybody is different. As someone who's lived with depression since, well, diagnosed in my early 20s and probably started before that, being on and off medication throughout my adulthood, it's actually, when you look at the research, brain chemistry aside, there are subsets of individuals who, when they have significant mood relapses within a certain time frame of stopping medication, the chance of them needing medication lifelong is much higher. At least that's the way that my psychiatrist explained it to me. And that said, we live in a world where diagnoses of mental illnesses like depression and anxiety is at an all-time high. And there is research to demonstrate that that does coincide with a lot of the environmental, cultural, and technological shifts that we've had. I listened to a podcast recently looking at children with anxiety, and there, while it is correlation not causation, is significant research to demonstrate that with the rise of the smartphone has been the rise of anxiety, and especially self-harm and other very concerning mental health problems, especially among young girls. So I agree with you. I think there's so many different factors. And of course, that's why traditional Chinese medicine is so important. When we think about environment specifically, I know I teach a lot about self-care and the different dimensions of self-care and wellness. And like we discussed, kind of similar to how traditional Chinese medicine looks at, everything holistically with self-care. It's not just about eating right and going to bed early and exercising. There's many different things, financial, social, and others. And environment is one of those things. And when I dove into that, I was like, environment, like, what does that even mean? Like, is that like the planet? Like, is that, and yes, that in fact is one of those things. But again, going back to the research, there is tremendous research to demonstrate how our environment impacts our mental health and well-being. Research in the workplace to show that if you live, or excuse me, work in a cluttered work environment, your chance of experiencing depressive symptoms is higher. If you, I can't remember exactly what the what the variable was, but something to do with your home environment being chaotic or cluttered or something like that, you are more likely to experience symptoms of anxiety. So we know that to be true. And I think this dovetails really well into another thing that I want to talk about, because I do think, and actually before I get there, I want to go back to something else that you said, which is this idea that there's something bigger beyond us, right? And that was one of the big things as well when I looked into the impact of the environment on our well-being, is these big experiences in nature, whether it's the vastness of the ocean or the majestic nature of the mountains, which is what I relate to where I live. It creates this sense of awe. And when you experience that awe, that's unexplainable, untenable, like almost like you can't put it into words, that there is a well-being benefit to that. And again, there's research to support that as well. Um,
I believe
yeah.
that. Because that's like hope. That's like having a reason to live. That's like this is the magic of our planet, of our
Yes,
world, of where we live. It's not just about the client that just yelled at me. Like, who cares?
exactly.
Like, who cares about
Yeah.
that person? They're having a bad day, you know?
Totally. It just broadens your perspective, which is why I really, part of me wanting to have this conversation with you was wanting to talk about your passion for ocean conservation, because you clearly identify with the importance of being in nature, enjoying the ocean, the impact that's had on you. Can you speak to this idea that caring for the planet, especially our oceans, is an extension of caring for ourselves and our communities?
Yeah, absolutely. I think that was one of the skills, I guess, that I was trying to uh, exercise. When I first came here, it's almost like looking for a purpose. Like I being a veterinarian was such a crucial part of my identity for so long, and like basically my whole life. I did want to be a veterinarian when I was a child. I just wanted to do other things too. So, it's identifying with it, but not being defined by it.
Mm-hmm.
So, so the ocean kind of, like, for me, it sort of gives me perspective on that, and what,
Mm-hmm.
like, having a purpose outside of yourself and outside of, what your goals are just for yourself, like literally, um staying in that sense of awe almost,
Mm-hmm.
right? And if we don't protect that, I see it firsthand here. Like, I live in a marine protected area. And when I first moved here, I thought, oh, that's so great. This is the first marine protected area in Costa Rica. They're really proud of it. They're really protecting it. And then I learned that, me on my little dive boat every day, I'm the one who's patrolling because no one else is, no one else is there, so it's like kind of understanding that no, you can't fix everything, but it's also, if you look outside yourself, there are small things you can do that can, if you're looking at small things in your environment, you can also look at things in your bigger environment that will make a difference for your smaller environment of, feeling at least proud of the accomplishment, or feeling like you can do something. Because
Mm-hmm.
I think that's also part of it, is that feeling of hopelessness. Like, we see all the stories about how everything's dying and everything's going away, and
Mm-hmm.
you can find all of those. But then I also watched the new documentary by David Attenborough, the ocean
Mm-hmm.
one.
Mm-hmm.
And oh my God, I love that man. He's 99 years old. He's seen, he was diving back in the 50s when our oceans were so full of fish that you would literally bump into them as soon as you jumped in the water. I mean, we don't have that at all anymore. But and he's seen all of that. He's seen all the, long lining, the trawling, how it's not just destroying the ocean. Our ocean is our lungs. It's everything. Like, that is our environment. If that's gone, our terrestrial environment is also gone, right?
Mm-hmm.
But the best thing about that movie was that it reminded me that, he was saying that, in a nutshell, the marine protected areas is the hope. That's the way forward. Community led initiatives to protect those marine protected areas that people are living around,
Mm-hmm.
kind of like where I'm living now. So I've been trying to, I guess, and it's almost like getting angry about something is also a good seed for getting things done, and getting some sort of action happening.
Mm-hmm.
So, I'm trying to see who else is interested in protecting our marine protected area that's not protected.
Mm-hmm.
So, and then that actually also helped with the depression side of it, because then I felt like I'm part of a community of people that also care about our environment. And then I feel like I'm part of something that is bigger than, like, it's not competition, it's collaboration.
Mm-hmm.
Like, and it's, people from North America, people from Costa Rica, people from Europe, but we all have the same goal. So, almost looking at the planet or your bigger environment, you can always find a mutual goal, even in
Mm-hmm.
those potential conflict relationships, right?
Mhm. I love that. Yeah, there's so much evidence to support this idea of social well-being, connecting with other people around a common goal or interest or purpose. You know, it really offers this sense of belonging, which is an antidote to loneliness, which a lot of people feel. And I would venture to say that probably, I mean, I know that what you do is volunteer. Like these are not initiatives that you are paid for. There's a lot of research to demonstrate that volunteering, doing something, you know, beyond that which we are compensated for, actually maybe counterintuitively brings us a lot of joy and also boosts our well-being. When we can do something to help out of the goodness of our hearts, and or because we are driven by purpose or passion around that, is really important. And I will link to that ocean documentary, as well as a podcast that we recorded on volunteering and the benefits of that, because I think that can't be understated.
Oh,
Um,
I agree 100% with I mean, the volunteering, it's like, it, yeah, it's something bigger than yourself that
yeah.
you can share. And it's there.
Oh.
And it's funny because I always thought, like, when I burned out very badly, I said, that's it. No more vet medicine. I'm never going back to this. Like, I could not look at another patient. Like, that's it. And then so of course, through the volunteering, I started helping at a wildlife rescue with some monkeys.
Mhm.
Um, and of course, that was free. Like you said, it's volunteering. And I thought that it was counterintuitive that I would actually gain my love back for veterinary medicine by not getting paid for doing it, you know. But it's almost like you get your identity sort of wrapped up financially in it too, because that's your
Yeah.
livelihood, right? So
Mhm.
when you can do it from the love of your heart, which is how we all wanted to do it in the first place, then
Mhm.
it really brings us back to why we chose this profession, right?
Such a great point. You know, I'm so fascinated by you, Galina. The more I get to know about you, you mentioned you're a diver. People maybe don't also know that you're an artist and a musician. I've had the pleasure of listening to you play the guitar and sing. How have these creative and spiritual outlets supported your mental health and emotional well-being, now and maybe in the past when you were immersed in vet medicine?
Yeah, I think I mean, again, looking back on my career, from RVT to, well, locum to emergency, like, I mean, I've done all of it. Practice owner twice, one
Mhm.
equine practice, one holistic. Anyways, but I think, like, oh gosh, sorry, I just lost menopause brain. I just lost that train of thought. Um, Sorry, can you ask me the question one more
Of
time?
course, yeah. So you know, you've got so many creative outlets that you have with your music and your artistry. Just wondering how that has supported your mental health and well-being.
Thank you. Yeah, so looking back on sort of my trajectory in my career, I noticed that the times that I felt the worst, so to speak, were the times that I was unable to tap into that creative outlet. So, because I think, again, like, you sort of get defined as being this veterinarian, this practice owner, this whoever, right? It's like there's nothing else, but that's not right. That it can't be. You are so much more than just that piece, right?
Mhm.
So I think it's important to cultivate, like, I mean, it doesn't have to be something creative. It could be something sporty. It could be just something else that is part of an integral part of your personality, of what you feel good doing. Like, I always I always thought, if it's something that I'm doing that I can lose track of time, then that's what I want to do. That's what I want to do. Because then
Mhm.
it doesn't feel like and that's actually a meditative state, isn't it?
Mhm.
It's like an active meditation, right?
Mhm.
So, and before I was going into, the veterinary field, funny enough, when I was in, high school and beginning college, I was an English major. I did art. I wanted to write novels. I went to Vancouver to, be a hippie on the beach. That's basically what I did at 18 after high school. And then realized I couldn't sustain that lifestyle. but, but that was always kind of the plan, as well as I love animals and I love the medical side of it.
Yeah.
But funny enough, it was a traumatic episode in grade 9 where my home ec teacher told me I was too stupid to learn science. And I think that stuck for so long
Oh.
that I didn't even realize it was there. And well, that was unpacked in therapy. But anyway, but that I think that was like an obstacle, right? I didn't even realize, but I was so impressionable at the time, and it was such a impressionable age that it stuck, and I didn't even realize it was there. And so the art was a really big part of my life already, but I kind of let it go when I got into the vet medicine side of it, which was very detrimental to my mental health, because
Mm-hmm.
then I had nothing to disconnect me from the veterinary side of it. There was nothing I could lose track of time with anymore.
Mm-hmm.
So cases would replay in my head. I wouldn't sleep because I'm
Mm-hmm.
like, oh, I got to call so and so. Oh, I forgot to, write this in the record. Oh no, what about this? And I'd wake up at 3 in the morning like, oh, I got to call so and so who's on shift because they're taking over my case and I forgot to check the calcium, or something
Mm-hmm.
like that. Or
Totally.
you've thought of a new approach or a new treatment or something else. So I found the creative outlet is so important to disconnect your mind from that,
Mm-hmm.
which of course is a slippery slope to depression, anxiety, mental health issues, and burnout, right?
Mm-hmm. Mm-hmm.
So I think if anyone has anything like that that they can cultivate and make sure they make time for,
Mm-hmm.
like put it in your schedule. I'm serious. You put it in your schedule and do
Mm-hmm.
it. And then
Love
I think
that.
that's what saves me. That's what saves
Mm-hmm.
me now as well. That was part of my recovery. It's like art therapy, right?
Mm, I love that. I love that. Well, it has been such a joy connecting with you. I feel like we could talk for another hour for sure. I am so grateful to have you as one of our facilitators at Reviving Veterinary Medicine. And so it's just been such a pleasure. And I do hope that more people get to connect with you through the lunch and learns that we offer and other things. In the meantime, where can listeners learn more about the work that you do and the services that you offer through Pura Vida Vet Wellness?
Sure, Marie. Well, I'm still everything's still in flux and changing. But I'm offering some retreats, some wellness retreats, and so if you're interested, it's puravitavetwellness.com. You can also find me on Instagram, same handle at Pura Vida Vet Wellness.
Love it.
So yeah,
Awesome.
come on, say hi.
Yeah, come to Costa Rica. I can vouch
Yes,
for how beautiful it is.
yes,
Last but not
and
least,
you.
Galina, yeah, what does the phrase reviving veterinary medicine mean to you?
Yes, I think reviving is keeping things fresh. And
Mm,
when I hear reviving about medicine, it's like, what is what's important to you? Like going back to what's important and what fuels you in that passion for that medicine. So it's keeping it fresh, keeping it relevant, keeping it what's important for you, like what it means for you, what
mm.
vet medicine means for you.
Love that. Awesome. Well, so glad we had the chance to connect today. Have a wonderful rest of your day, and we'll talk again soon.
Thanks, Marie. It was a pleasure.